Welcome to Opposing Views, a hard, straightforward discussion of today's most pressing issues. We all want to prevent the spread of HIV in the Philippines and those who are infected to stay healthy. But the method on how to do so differs. For the Department of Health, one way is to implement a compulsory HIV test. We'll debate about the issue tonight. Our question is, will mandatory HIV testing decrease the number of HIV/AIDS cases in the Philippines? Good evening, I'm Datin Paduka, and this is Opposing Views. The number of Filipinos living with HIV has reached an unprecedented level. The country recorded an 820% increase in a span of 9 years, from 173 cases in 2001 to 1,591 cases in 2010. The Philippines is one of 3 countries in Asia and one of only 7 countries in the world with a growing HIV epidemic. There is an estimate of 14 new HIV cases every day. HIV, or human immunodeficiency virus, is transmitted from having unprotected sexual intercourse, transfusion with infected blood, sharing of syringes and needles with someone who's HIV positive, and mother to their unborn babies or through breastfeeding. HIV is the virus that causes the acquired immunodeficiency syndrome, or AIDS. In order to address the alarming HIV spread in the country, Health Assistant Secretary Eric Tayag recently pronounced that the Department of Health would want to shift from voluntary HIV testing to something compulsory. The department cleared that this is not for all Filipinos, but for specific groups only, following a risk-based assessment. But Republic Act 8504, or the Philippine AIDS Prevention and Control Act of 1998, clearly states no compulsory HIV testing shall be allowed. Instead, the state shall encourage voluntary testing for individuals with a high risk for contracting HIV. The department said that they are talking to legislators for a possible amendment of the said law. Sexual rights advocates slammed the said idea by DOH, saying that this will cause panic, discrimination, and would force people to hide their condition. They also threatened that they will call for DOH Secretary Enrique Ona's resignation if they implement the mandatory HIV testing. Joining us tonight in our discussion is Dr. Lyndon Lee Sui, spokesperson of the Department of Health. Good evening, Dr. Lee.
Yeah, good evening,
okay.
Rod.
Good evening. Can you give us a quick summary of your points, of your position regarding this question?
Well, mandatory testing will only be provided to a certain group, which are the patients who would undergo special procedures like operations. So it will be limited only to these people.
All right. Okay, now, on the other hand, the opposing side is we have a former Health Secretary, Dr. Esperanza Cabral. Good evening, ma'am.
Good evening, Attorney Rod.
All right. Ma'am, what is your position regarding this? A quick summary of your position.
My position is mandatory testing has to be carefully thought out because we need to balance civil rights against public protection. And we need to make sure that our ability to protect the public by mandatory testing far exceeds, the benefits of that far exceeds the harm that violating civil rights may do.
All right. Now, okay, let's start off our discussion. Dr. Lui, I'm sorry, I called you Dr. C. I'm sorry. My apologies. Dr. Lui, let's clear the air first.
But I'm not Benhard Lui.
You're not. We want to clear that. All right. So, Dr. Lui. All right. Not related though.
Lee Sui.
Lee Sui.
It's Lee Sui.
Lee Sui.
Yeah.
Oh, okay. All right. Says Dr. Lui. All right. So I'll call you Dr. Lee Sui.
No, Lyndon will be fine.
Lyndon. Dr. Lyndon. All right. Okay, Dr. Lyndon, let's get the picture straight. No? There are a lot of people reacting to this, as you may know. What exactly is the plan of the DOH with regards to mandatory HIV testing?
Actually, since the other week, everything has gone out of proportion simply because they were thinking the mandatory testing will be implemented to all, say, Filipinos, high-risk group like MSM or intravenous drug user, which were not actually being considered by the Department of Health. Our proposed mandatory testing, meaning it's not yet a law, would be focused only to those people who would undergo special procedure. Now, why are we focusing on them? They'll be undergoing a stressful situation like going into an operation, and we have to take care of them because their immune system will go down, their resistance will go down as well, and we may need to provide some other approach for them to be able to recover at once or faster. Another reason is that we may need to protect as well the health workers, the ones going to perform the operations. By knowing the status of the patients that would go into the procedure, there may take some extra precautions or some procedures that may need to go through so that transmission will be prevented in a healthcare setting.
All right, because I guess the confusion, Dr. Lyndon, is that there were some statements, and to quote you, at least to there are several media outlets who've quoted you as saying, gusto namin na mas malaking malawak at nasasakupan ng law ng sagayon as mas malaki ang grupong matatarget natin para ma-avail ang gamot para sa HIV. So the impression is that you're trying to expand the coverage,
Exactly.
Not just those who are going to go through operations or surgery, but also
by expanding we mean for those patients who will go through the procedure, malalaman natin kung positive sila, and they can avail of the services offered ng Department of Health for those patients who will be tested positive. So meaning, by expanding, we mean through this group, baka may makatch tayong positive, at baka kailangan nilang mabigyan din ng mga services, like the antiretroviral medicine, the counseling, for them to be able to lead a more productive life after the procedure. So yun, hindi naman na-expand that we're including some other groups here. Why do we need to invent the will kung meron naman talagang ginagawa na for them?
All right, thank you. Dr. Lyndon. Dr. Cabral, in your, at least from where you're coming from, you feel that any kind of mandatory testing shouldn't be allowed?
That's not true, though. I think that there are some instances when mandatory testing may be allowed. But before we do any mandatory testing, there are certain requirements that we have to fulfill. For example, the first is that what we are testing is something serious. Because obviously, if it's a mild thing, you don't need to do any screening for it. It's just going to happen and people are going to recover and that's going to be it. But if it's something serious, then we might be able to consider that. Second is it has to be prevalent. If the case or if the disease or the condition is not prevalent, like HIV/AIDS, which has a prevalence rate estimated at present to be 0.001%. Then you're going to have to test 1 million people in order to identify 10 people with HIV. And you're going to have to spend $1 billion pesos
from a fiscal standpoint,
in order
at least,
to diagnose one. And that's just not cost effective. Second is you must be able to handle the people whom you test positive, if you ever test them. Because what's the use of testing if you're not going to be able to give them the goods and services that they require? And I don't think that at present we fulfill that particular requirement. And of course, the other important thing there, as I mentioned before, is that the predictable benefits must far outweigh the potential risks, including the violation of human or civil rights.
Which is key.
Yes, which is key.
Very important, yeah.
Yes, in order to provide public protection.
Now, do you feel, ma'am, Dr. Cabral, do you feel that the DOH recommendation is an assurance that the rise of HIV cases will be halted? Do you think that their recommendation of at least as Dr. Lyndon was saying, the mandatory testing on these people who are about to get operated on, do you think that that will lessen the number of HIV cases?
No, I don't think so. Because the people who are going to go into operation are going to be like the general population, where the prevalence of HIV/AIDS is going to be very small. And so if it is going to be something like that, there is no way that you're going to prevent a rise in the prevalence or incidence of HIV.
Now, when you were health secretary, did you feel the need to do so, to have some kind of mandatory testing for HIV?
No, I felt the need to implement the law as it is because there are so many provisions of the current Republic Act 8504 on HIV/AIDS that have not been implemented. And I think that if we do that, without going into mandatory testing, we are going to be able to reduce the prevalence of and incidence of HIV in the country.
Dr. Lyndon, the position of former health secretary, Dr. Cabral, her feeling is that one, of course, there's an impact here on the right to right to privacy. No? That's the first thing, and also it is going to be very costly to be implementing this, considering that HIV, at least based on former Secretary Cabral, is not that prevalent yet. Do you personally feel that having this kind of mandatory compulsory testing you think it will address the rise in HIV cases?
We did not claim that we're going to stop the rise or will bring down the number of HIV cases by doing the mandatory testing. What we intend to do here is to protect as well other possible potential patients or potential people that might get infected by performing some procedures to these patients. That's our main purpose here. Another thing is, as I said a while ago, Secretary Cabral was saying, like, we may not have the provisions to provide our patients or somebody who will be tested positive. Before we got into this, we actually made sure that we do have enough services that we can offer.
Enough resources.
Whoever be tested positive, like the medicines that will be given to them. And all we want to do is after the procedure, after the testing, whoever will be tested positive, they can avail whatever services that we can actually give them.
All right. Now, in your mind, and I kind of have a feeling what your answer would be, but is the healthcare system ready? Our healthcare system ready to address this epidemic?
We will not have, we're focusing on the mandatory testing.
Yes,
I mean, if we're ready with that.
Yes.
We will not be endorsing this one unless we're really ready to address this issue. But then let me qualify this. When we say mandatory testing for those who are going to undergo the procedure, we may need to, there's a venue, of course, for this, to qualify who among those to be tested among those going through operations.
Okay.
I don't think it will be everyone as well.
Yeah. Can you explain what the
like
qualification
probably
is?
Like the age group may be considered as well. Those like people who would undergo, say, major operations, like what Secretary Cabral said a while ago, minor operations, or probably some minor procedures may need not go through this because the risk of acquiring the infection may be very low. Those you need to go through the mandatory testing. So the room is still open. We may need to come out with guidelines on who would be tested, who needs to go through the procedure, and whoever will be tested will go through the same process as well. Like anybody who would come in for testing, there will be counseling. We will practice utmost confidentiality as well with this one. So ang nakaiba lang is that these will be patients who will undergo procedures like operations.
Yeah, I think the concern also, Dr. Lyndon, is stems from the fact that whenever you put the word mandatory, compulsory, it means under penalty of law, di ba? Meaning you have to do this, otherwise you will suffer something. So what are those consequences in your mind? What will be those consequences if they say no?
Actually, the noise now was because of the word mandatory.
Yes.
Would have been different if you use the word routine.
Or recommendatory?
No, recommendatory would be different with routine.
Okay.
If we actually made use of, HIV testing will be part of the routine exams before a patient goes through, say, a procedure. So,
it's a terminology there. Ma'am, do you think that by changing it to routine, do you think that will address your concerns about this plan?
If you change it to routine, then it will become voluntary. It will not become mandatory anymore. Because you can opt out.
Yes.
Let's put it that way. You can say, no, I don't want to have the test done.
Yes.
So it is not going to be mandatory anymore.
Yes, but the whole concept though, the whole concept of it that you have to.
Yes.
You have to do it. That you're against that, right? That you have to.
On a general basis, yes. There has to be really good reason to make a test mandatory, as I said.
All right, okay. All right, we need to take a short break. Meanwhile, you can react online via Facebook at facebook.com/SolarOpposingViews or tweet your comments at opposing_views. Use the hashtag OV mandatory HIV test. Stay tuned. You're watching Opposing Views. We'll be right back. Welcome back. You're still watching Opposing Views on the Solar News Channel. We have with us Dr. Lyndon Lee Suy, spokesperson of the Department of Health, and former Health Secretary Dr. Esperanza Cabral. And our debate question for tonight, will mandatory HIV testing decrease the number of HIV/AIDS cases in the Philippines? All right. Dr. Lyndon, what is the basis? What is the basis of choosing patients undergoing the procedure as the first high-risk group for mandatory testing?
Well, we have not really come out with, say, an activity or public advocacy in a healthcare setting, meaning transmission can also happen in this area. So one way is really making sure that the infection is not transmitted from patient to the physician as well, or to the healthcare worker. So in one way as well, to first be able to get or be able to detect patients who will be tested positive is through those patients who would undergo procedure. So we were limiting it to them first.
All right, okay. Ma'am, Dr. Cabral, are you for that? Let's say those particular patients that Dr. Lyndon said.
I think that those patients, and we're not talking of emergency cases,
yeah, they're not
right?
emergency. These are people who are going to public health facilities, right?
I think that in the initial evaluation for surgery, then counseling on HIV testing should be given. And if the person has if there is a high index of suspicion that this person might be having HIV or AIDS, then this person should be strongly encouraged to undergo the test. Otherwise, if the person does not want to do that, then we just have to be careful. If we feel that this person probably has HIV, we have to exercise even more care when we are doing surgery to make sure that there is no contamination of blood or other body fluids from the patient to the healthcare workers.
All right. Now, ma'am, in your mind, is mandatory HIV testing? You mentioned earlier it violates the right to privacy and the freedom of choice. Do you think that is enough justification, considering the risks involved with a disease such as AIDS, for example?
For the general population, no, it's not. Okay, because really the prevalence is so low, and it's going to violate the rights of so many people before you can come up with somebody positive for HIV.
So you're saying it definitely will violate, right?
Right. Yeah, it does. It violates. But of course, our civil rights have limitations too. Yeah. And if it impinges on public protection, then we are going to have to think of it in a secondary manner to the public protection.
Right. Okay, Dr. Lyndon, the position of former Secretary Cabral, it's not yet in that stage. I mean, this disease, I mean, she pointed out a percentage, 0.001%. So we're not yet far from an epidemic, I guess, an epidemic proportion. So in that regard, do you think that it's worth even suggesting this mandatory testing, considering the number of civil rights or human rights to privacy you're going to have to violate? Just the thought of it, of making it compulsory for these people, routine, as you would say. But because I guess it's okay to have a routine checkup on your ears and your eyes, but this one has, let's face it, it has a lot of stigma involved, right?
Stigma would only come in if you're going to consider stigma. Okay, but then currently the rate is at 0.0001, but then we might just be at the tip of the iceberg. You just mentioned about stigma. We wanted to address that as well, that it's not really a problem for you to come out and be tested, simply because there's something that we can do for you. So I don't think that should be a reason for us to stop on what we would want to do, for us to be able to provide and lead a patient who will be tested positive, for him to, or her to have a more productive and quality life.
All right. Well, Doctor, do you think, though, this will it cause discrimination and stigma if we have this kind of requirement?
Knowing that somebody has HIV or AIDS, definitely there is stigma attached to that particular condition.
Because I'm not just talking about the Philippines. No? I mean, we also, I don't know if you also, Donald Sterling, you know, with his very, almost, I have to say, ignorant comments regarding HIV and AIDS. In fact, confusing HIV and AIDS, right? So, will you agree with me, Doctora, that it will cause some kind of discrimination if we require this?
The requirement itself will not cause discrimination. It is knowing that somebody has HIV or AIDS that that will give you discrimination.
But that's the point. If you do the testing, you will find out if the person has HIV or AIDS. So.
Not really, because there is confidentiality of these results. It is not going to be made public to the entire 100 million Filipinos. It is something that is between the physician and the patient.
Okay. Now, you think, though, isn't it the government's objective to change the stigma against HIV testing? Do you think it is? Do you think it's the government's a role or responsibility to change the stigma that's attached to HIV?
Well, I think, yes, the government has some responsibility to see to it that these people are not discriminated against. But that is a long, hard climb. It cannot be a dictum. Today, I say you should not discriminate people with HIV/AIDS, and tomorrow that happens. It just doesn't work that way. It has to be by making people aware that even if you kiss a person with HIV/AIDS, you are not going to contract HIV or AIDS. And this has to be repeated. It's like advertising for a soft drink. Every day you have to do it, because if you don't, then they forget about it. It's not just HIV/AIDS, which is a matter for discrimination. Even tuberculosis is a matter for discrimination. When people find out that you have tuberculosis, they tend to shy away from you. They don't want to talk to you because you might cough in their faces and you might contract tuberculosis. In fact, that is the reason why for employment, a chest x-ray or some other procedure that is going to diagnose tuberculosis is required, mandatory. But at the moment, people accept that. And we have to get to the stage where people accept testing for HIV or AIDS.
Do you think we'll reach a point, Dr. Lyndon, because we were talking about, let's talk about that point, no? Testing for employment, for example. Do you think we'll ever reach that point that maybe even for employment, let's say even in government, you would require mandatory testing of HIV?
I don't think so.
No.
The law says that we cannot do mandatory testing for employment, even for schools, say for housing as well, or even for other services that are being offered by the government.
So that one will never,
it will never happen. It was never even considered.
All right, okay. Just again, that's I guess we're communicating that to our televiewers now. So this will never happen, this kind of mandatory testing. All right, so I'm glad you cleared that up. All right, we need to take a short break. More on the issue of compulsory HIV testing when we come back. Please stay with us.
Pabor po, para malaman natin kung malinis tayo o hindi.
Pabor ako kasi ma-prevent yung pagdami pa ng merong may sakit na HIV.
Pabor ako doon sa panukala na yun.
Bakit po?
Para malaman natin kung sino talaga yung may mga sakit sa kababayan natin, di ba? At least para magamot sila, di ba?
Okay, para sa akin okay lang naman since one way rin yun para malaman kung meron ka talagang AIDS.
Para po sa akin, actually, I'm not in favor for that one. It's because that it's your choice and it's your optional for that one. Kasi private yan, it's really important for us na, syempre, it's really a shame na malaman ng ibang tao.
Hindi po ako pabor na mandatory yun.
Bakit po?
Kasi hindi naman, mas maraming ano na yun, maapektuhan na tao doon kasi hindi naman, makikita mo nun sa isang tao kung HIV o wala, di ba? Eh, ba't mo may mandatory pa yun?
Kung malalaman ng tao na ang isang empleyado meron nun, hindi naman sa iiwas, kundi para lang ma-avoid na hindi na makahawa pa.
Kailangan siguro acceptance na may sakit ka. So you need cure. Yeah, yun. So it needs attention.
Welcome back. You're still watching Opposing Views on the Solar News Channel. I'm Rod Nepomuceno. Still with us, Dr. Lyndon Lee Sui, spokesperson of the Department of Health and former Health Secretary Dr. Esperanza Cabral. And our question for tonight, will mandatory HIV testing decrease the number of HIV/AIDS cases in the Philippines? Now, Dr. Lyndon, the general feeling is that there's the stigma that we were talking about, that HIV, when you say the word HIV and AIDS, it's usually related to a disease that you contract from sex, no? And that seems to be where the stigma is coming from. That's something for a lot of people. It's very private, you know? And that's the reason why those who are speaking out are people who feel that they're being singled out. You know, those who have HIV or those who may be having a lifestyle that could lead to that. Now, you mentioned earlier that the government has the resources to conduct the mandatory or compulsory testing that you were proposing regarding for pre-operation purposes. And we were discussing this off-air with Dr. Cabral. Do you think that perhaps maybe the budget that's allotted for this can be better used for other, well, should I say, other diseases that are not in, that are more, should I say, prevalent in number? Because as we mentioned earlier, 0.001% is not an epidemic. There are other diseases that probably require more attention. So do you think that the government is using its resources wisely by focusing on this?
We have not really explored on how the, say, payment scheme would be for the testing of HIV/AIDS, but then that will come in next once the mandatory testing is really pushed and be allowed to be used. So it's something that we need to explore as well regarding on, say, whether it be provided for free or do we need to charge, or do we need to charge it, say, through some payment scheme or healthcare, like, for example, PhilHealth, that we need to explore.
Now, Dr. Cabral, we were talking earlier, you mentioned that, you did say that there are probably more diseases, apart from HIV, that would probably benefit from the budget of the government that's being used for mandatory testing.
Well,
you
yes.
mentioned that. Can you elaborate on that?
Yes.
And do you think that that's the case? We should be
Yes.
using the fund na lang for something more important? As you were
First,
saying.
let me say that I agree that HIV and AIDS HIV/AIDS is a very serious problem, and that we should not be ignoring it just because the prevalence rate is low right now. We want to keep it as low as possible. We don't want a 10% prevalence of HIV. We want it to remain at 0.001. But as we said, there are many other conditions that the Department of Health can probably spend its money more wisely on rather than on mandatory testing. And even when it comes to just HIV, there are many alternatives to mandatory testing that will help bring down or keep the rate of HIV down. And those are the things that we should focus on. For example, as we were talking about earlier, the law right now, Republic Act 8504, requires contact tracing, which is not being done. So I think that what should happen is the government should make a good effort to enforce and implement what is already in the law instead of making another law.
I'm glad you pointed that out, Dr. Cabral, because actually that was my next question. The DOH has been lobbying some legislators for a possible amendment of the age law. Now, I mean, in your mind, Dr. Lyndon, do you think we should amend the age law? And if ever, what amendments do you think we should have to further address this?
The law was made in 1989. At that time, we do not have any, well, not much information yet as far as HIV/AIDS is concerned. The law was actually based on, say, countries where they have a better understanding of what HIV is at that time. But then it's been like 30 years since the law was made. And I guess there are some part of the law that may need to be reviewed and lobbied for, say, amendment for that, so that we'll be able to implement some of the procedures there. Like, for example, what the Secretary said a while ago, contact tracing. We agree that it's part of the AIDS law, but then it's part of the one that we're lobbying as well, that we need to enhance on the contact tracing. And it's not only focused on the contact tracing, what we are lobbying here. We would also want to include that provisions for, say, ARV should be in place, strengthen as well the advocacy so that they will know as to where to avail of these services. And one small part will be on mandatory testing for this sector, for those people who would undergo operation. So it's not really limited only to mandatory testing, but rather would include other things that we may need to strengthen, like contact tracing.
Okay. Now, are there case studies abroad regarding or similar to what you are proposing? Because again, we were talking earlier, and I know foreign governments refuse to fund anything that will require mandatory testing. So, but maybe you can enlighten us with this, Dr. Lyndon. Are there case studies abroad, maybe in other countries, where they implemented this kind of mandatory testing and resulted to, there were tangible results in terms of lessening the cases of HIV? Yeah,
let me make this clear, Attorney Rod. We do not really claim that doing the mandatory testing will bring down the number of HIV/AIDS cases. We have other reasons why we would want to do this, like, for example, taking care of those patients who would undergo the procedure. Now, we do not know of any country as of now that has implemented mandatory testing for patients who would undergo any procedure. But then that shouldn't stop us from doing things that we think would be of benefit eventually for everyone.
So what is the, so I guess what's the basis though? I mean apart from, because the ultimate basis or reason for it is that you want to be able to provide the right medicine
for the healthcare facilities set up naman. Yeah.
Okay. All right. So if you were limited to that, Dr. Cabral, limited to just that, for those people who are going to go through surgery, okay, not because as earlier mentioned by Dr. Lyndon, even those who are entering the public health facilities lang for checkup and all that may requirement. But let's say we focus purely on that, on those people who are about to have surgery. Do you think that making it mandatory is reasonable?
No, I don't think so. Yeah, I would rather make other tests like hepatitis B or hepatitis C required instead of HIV/AIDS, because I know that the prevalence of hepatitis B and hepatitis C far exceed the prevalence of HIV/AIDS. So it's going to be more cost effective. And anyway, you still need to be aseptic in your techniques. You still need to practice every kind of precaution so that you, if you are the healthcare provider, are not contaminated, and you as the healthcare provider will not contaminate your patient, because this is a two-way street.
Yeah, yeah.
Okay.
No,
So, in fact, you could argue that if you are going to test the patient, you should be testing the healthcare provider too.
Okay. Now, Dr. Lyndon, apart from HIV or AIDS, no, or are there other diseases where you require or you are proposing such kind of compulsory or mandatory testing?
Well, some of them might come in next, like what the Secretary proposed a while
is
ago.
just the first.
Yes.
I guess that's where I guess the questions are coming up, you know, because it happens to be the first.
Right.
And because it's HIV and AIDS, and it's a very sensitive topic, it involves people's, I guess, sexual habits.
Would it have been different if we started with hepatitis that eventually include HIV/AIDS?
I don't know. We can't tell, because the first one that came out was HIV and AIDS, and as you know, there was a lot of reaction to it. So
But then definitely things are being considered here, especially those diseases that are being transmitted through say, blood
body fluids.
contaminations and
because
body
I
fluids.
think, as we mentioned earlier, I think they feel that this group, they're being singled out. So
No, definitely not, because we're not limiting ourselves with HIV/AIDS.
All right. All right. We need to take a short break. Opposing Views will be right back. Please don't go away. We'll have our poll when we come back. Welcome back. This is Opposing Views. I'm Rod Nepomuceno. Our guest, Dr. Lyndon Lee Sui, spokesperson of the Department of Health and former Health Secretary, Dr. Esperanza Cabral. And we asked for tonight, will mandatory HIV testing decrease the number of HIV/AIDS cases in the Philippines? Now, ma'am, we have a couple of minutes left, so I'm gonna ask this. If it's not this mandatory testing, what is your alternative? What do you propose? I guess to rephrase that question, what is your alternative in case that you're blocked by the DOH in implementing this policy? No? What other alternatives do you have apart from mandatory testing?
In case the DOH is blocked from doing this mandatory testing, they can do many other things. They can strengthen the counseling and voluntary testing program that is currently in effect. They can strengthen their contact tracing, which is also within the law. They can strengthen their information campaign. They can strengthen or encourage people to do what should be done, which is A, abstinence, B is, ano nga yung B, Linda?
Be loyal.
Be loyal.
Be faithful.
Be faithful.
Yeah. Okay.
And C, use your condoms.
So just further the education, strengthen the education there. Dr. Lyndon, in your case, if let's say the clamor is too loud, no, and the noise is too loud, and people are really going to go after you, there's some groups who have said that they'll actually go for the resignation of the secretary if this goes on. What are the alternatives?
Well, definitely, Attorney Rod.
You're listening.
It's not yet a law now, okay? And before it becomes a law, there will be a public discussion on this one. They will be invited. There will be venue for this. So that we'll be able to discuss with them on how to better approach this one. But then definitely we're pushing on the mandatory testing.
Okay. But do you think, though, that to some extent, Dr. Lyndon, do you think that the DOH was maybe misconstrued, or there was some kind of miscommunication there to the public?
Exactly. The clamor was really thinking that the mandatory testing would be for everyone.
Yeah.
For the high-risk group, like, for example, the MSM, the intravenous drug user, where in fact they were not even considered when we were thinking about mandatory testing. There's no such thing as another problem that they're raising up would be after these patients would undergo surgery, the next group will be those MSM and those, say, intravenous drug users. That won't happen because we already have some approaches with them already, like, for example, for MSM, the practice safe sex, for intravenous drug users, for the syringe, So we already have approaches for them. Why reinvent the wheel? Meaning, we're focusing only on this group.
Okay. And of course, can you maybe relate, just for our televiewers, no? What are the other programs of the Department of Health, apart from this mandatory testing? I mean, can they go to a site, for example, where you know, if they need to get more educated on HIV and AIDS?
Yes, we have expanded our surveillance as well. We made sure that our treatment hub will have enough medicine available for patients who would want to avail of our ARV. And of course, we're expanding as well on we want to strengthen our advocacy as well, for them to know on, really, we need to review again with them on how to avoid HIV/AIDS, things that they need to do, and if they think they're infected, how would they go through the process. But then, as what Secretary said a while ago, no one would know if you're tested positive. That we can assure.
Okay, so
we practice utmost confidentiality.
Yeah, here. I think that's where it all stems, the concern. Parang, as we saw from the interviews earlier, people were saying if people find out that I'm HIV positive, and that's what bothers them. The stigma. You
know what, attorney? Even your parents wouldn't know unless your patient gets to tell you, yes, you can tell my parents about this. So everything will have to come from the patient himself.
All right.
But then not from the health workers.
Okay, we reached the tail end of our show. So we'll ask our guests. I'll start with you, Dr. Lyndon. Can you give us your parting words, your final words to our televiewers out there?
So nothing's final with mandatory testing. We're pushing it simply because we do have a cause for this one. And what we would want to achieve here is not really bringing down the number of HIV/AIDS cases, but rather providing them with a quality and a better life after being tested positive.
All right. Thank you very much, Dr. Lyndon C. Luy. Thank you so much. And Dr. Esperanza Cabral, your final words to our televiewers?
Well, I would encourage the Department of Health to see to the enforceability and the implementation of the current Republic Act that deals with HIV/AIDS. Because there are many things there that are good, that will work towards reducing the prevalence and incidence of HIV/AIDS if only we can implement them on a universal basis, on an effective and efficient basis.
Right. Okay. The title of the show might be Opposing Views, and we might have opposing views on how to handle things. However, I think we're all on the same page when we say we want to get rid, or at least decrease, always decrease the number of cases of HIV and AIDS. So thanks to our guests, Dr. Lyndon Lisoy and Dr. Esperanza Cabral. Thank you very much. Now let's feel the pulse of our viewers through our online poll. Our question: will mandatory HIV/AIDS testing decrease the number of HIV/AIDS cases in the Philippines? Those who answered yes, 40%, and those who answered no, 60%. And that's our opposing views for tonight. Tune in again next week for another bold and engaging discussion on today's most pressing issues. I'm Rod Nepomuceno. Good night and God bless. And this is the kind of show that at least naka-clarify.
Nag-ingay lang ng iba ang ginamit na dahilan. Like for example, they were saying like, we should stop it because MSM are next, intravenous drug users are next. Hindi naman namin planong gawin yun.
Yun nga yung nagiging impression.
Doon sila nagbabag sa issue na yun.
Thank you for taking the time. I know it's Friday night, so maraming po salamat. Okay, yeah, thank you.
Only be provided to a certain group, which are the patients who would undergo special procedures like operations. So it will be limited only to these people.
All right. Okay, now on the other hand, the opposing side is we have a former Health Secretary, Dr. Esperanza Cabral. Good evening, ma'am.
Good evening, Attorney Rod.
All right. Ma'am, what is your position regarding this? A quick summary of your position.
My position is mandatory testing has to be carefully thought out because we need to balance civil rights against public protection. And we need to make sure that our ability to protect the public by mandatory testing far exceeds, the benefits of that far exceeds the harm that violating civil rights may do.
All right. Now, okay, let's start off our discussion. Dr. Loy, I'm sorry, I called you Dr. C. I'm sorry. My apologies. Dr. Loy, let's clear the air first.
I'm not Benhard Loy.
You're not. We want to clear that. All right. So Dr. Loy. All right. Not related though.
Lee Sui.
Lee Sui.
It's Lee Sui.
Lee Sui.
Yeah.
Oh, okay. All right. So Dr. Loy. All right. So I'll call you Dr. Lee Sui.
No, Lyndon will be fine.
Lyndon. Dr. Lyndon. All right. Okay, Dr. Lyndon, let's get the picture straight. No? There are a lot of people reacting to this, as you may know. What exactly is the plan of the DOH with regards to mandatory HIV testing?
Actually, since the other week, everything has gone out of proportion simply because they were thinking the mandatory testing will be implemented to all, say, Filipinos, high-risk group like MSM or intravenous drug user, which were not actually being considered by the Department of Health. Our proposed mandatory testing, meaning it's not yet a law, would be focused only to those people who would undergo a special procedure. Now, why are we focusing on them? They'll be undergoing a stressful situation like going into an operation, and we have to take care of them because their immune system will go down, their resistance will go down as well, and we may need to provide some other approach for them to be able to.
2010. The Philippines is one of 3 countries in Asia and one of only 7 countries in the world with a growing HIV epidemic. There is an estimate of 14 new HIV cases every day. HIV, or human immunodeficiency virus, is transmitted from having unprotected sexual intercourse, transfusion with infected blood, sharing of syringes and needles with someone who's HIV positive, and mother to their unborn babies or through breastfeeding. HIV is the virus that causes the acquired immunodeficiency syndrome, or AIDS. In order to address the alarming HIV spread in the country, Health Assistant Secretary Eric Tayag recently pronounced that the Department of Health would want to shift from voluntary HIV testing to something compulsory. The department cleared that this is not for all Filipinos, but for specific groups only, following a risk-based assessment. But Republic Act 8504, or the Philippine AIDS Prevention and Control Act of 1998, clearly states no compulsory HIV testing shall be allowed. Instead, the state shall encourage voluntary testing for individuals with a higher risk for contracting HIV. The department said that they are talking to legislators for a possible amendment of the said law. Sexual rights advocates slammed the said idea by DOH, saying that this will cause panic, discrimination, and would force people to hide their condition. They also threatened that they will call for DOH Secretary Enrique Ona's resignation if they implement the mandatory HIV testing. Joining us tonight in our discussion is Dr. Lyndon Lee Sui, spokesperson of the Department of Health. Good evening, Dr. Lee.
Yeah, good evening, Rod.
Good evening. Can you give us a quick summary of your points, of your position regarding this question?
Well, mandatory testing will only
Welcome to Opposing Views, a hard, straightforward discussion of today's most pressing issues. We all want to prevent the spread of HIV in the Philippines and those who are infected to stay healthy. But the method on how to do so differs. For the Department of Health, one way is to implement a compulsory HIV test. We'll debate about the issue tonight. Our question is, will mandatory HIV testing decrease the number of HIV/AIDS cases in the Philippines? Good evening, I'm Datin Paduka, and this is Opposing Views. The number of Filipinos living with HIV has reached an unprecedented level. The country recorded an 820% increase in a span of 9 years, from 173 cases in 2001 to 1,591 cases in